Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And remember, you can always find Let's Talk Micro on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, GoodPod, Stitcher, TuneIn Radio, Pandora. Wherever you get your podcast, you can find Let's Talk Micro. As far as social media, I am on Instagram as Let's Talk Micro, no apostrophe, on Twitter as Let's Talk Micro 1, on LinkedIn as Luis Plaza, and on TikTok as Let's Talk Micro. So go ahead and subscribe to the podcast, follow me on social media, leave a review, especially, if you download an episode and if your app allows you to leave a review, go ahead and please do so. That's always really good for the podcast. On social media, I always like to post pictures of organisms and give updates as to when the next episode is coming out. And I also have an email address, which is letstalkmicro@outlook.com. So if you have any topic suggestions, feel free to leave those over there. Email me, any feedback, any suggestions, they are always welcome and appreciated. And if you haven't listened to the previous episode, go ahead and do so. It was a great episode with Dr. Madeline Barron. She's a correspondent at ASM. She writes articles for them. Pretty cool job, doing research, putting great information out there. So she joined the podcast on that episode, talk about microbes in your cleaning appliances and tools. That's something that you might think about or might not think about. So sometimes, your sponge, sometimes, it gets that smell and you throw it out. You microwave it, maybe get a new one. Things like your dishwasher, your washing machine. So what kind of microbes do we see there? Your showers. She even talks about rubber duckies. So it was a great episode to know about, what kind of microbes. You have viruses, you have bacteria. So definitely, it was very interesting to learn and get familiarized with what kind of microbes, you see in these cleaning tools and appliances. She also gives advice on how to properly clean those devices, those appliances. And what does that mean for our health? Should we be alarmed or should we not? It was a great episode, so if you haven't checked it out, go ahead and do so. So today's episode is about Bacillus. So those of you out there in the public, in the audience, that enjoy the type of episodes where I talk about organisms, biochemicals and reactions, well, this episode is definitely for you. So today we're going to be talking about Bacillus. And those of you that work in microbiology, you're familiar with Bacillus. And those of you that might just be starting to study micro might have heard of a species of Bacillus, which is Bacillus anthracis, which causes anthrax. So even if you're not familiar with Bacillus, at the very least, maybe hearing in the news, maybe reading about it, but you have heard about anthrax, and that is caused by Bacillus anthracis. And Bacillus anthracis, it has the potential of being used as a bioterror agent. And even though, fortunately, we might never see it in our careers, right? We really hope so. We are trained on how to recognize it in the lab. And you remember the episode about Yersinia pestis? For those of you that have not checked it out, go ahead and do so. It is episode 65, and it is titled Yersinia pestis. In that episode, I talk about Sentinel Labs, and I also talk about the laboratory preparedness exercise, which is LPX, right? So how we are training the lab to recognize these organisms and what to do. You have a different, like a flow chart where you do some biochemicals, some testing, and then if you are unable to roll out a certain organism, then you go ahead and notify, your health department, your state health department. And then you send that suspect organism. You let them know, I suspect, Yersinia pestis. I suspect Bacillus anthracis. And you properly package the organism. And then you send it to that lab to either, rule in or rule out that organism. So definitely, if you want to, refresh, get a refresher on that information, definitely go ahead and check out that episode, which is episode 65. But definitely, the same process that you use for Yersinia pestis, you also use it for Bacillus anthracis. You notify the state lab, you send a sample for confirmation. But however, Bacillus anthracis is going to have its own episode. So let's go ahead and talk about Bacillus. So Bacillus is a genus that belongs to the order Bacillus and family Bacilliaceae. With molecular advances, bacteria that were previously classified as Bacillus, they have been reclassified. Many have been renamed to be consistent with a proposal that the Bacillus be reserved for organisms belonging to the Bacillus series and subtilis groups. And there are many genera that are related. However, about 5% of the isolates are of clinical significance. And the most common genera that we see in the lab, there are Bacillus, Bacillus, Brevibacillus, and Lysine And there are several Bacillus groups. And those of you that work in micro, you're familiar with the term group, right? This is something that you hear in microbiology. You hear the word group. You also hear the word complex. And this is, a group of, a group or a complex is definitely, it's some organisms that they are very similar, and then they are put together in a group. Those of you that work in micro, can you think of some groups? Well, right, you have, for example, examples are Enterobacter cloacae complex, which is comprised of, right, you have Enterobacter cloacae, Enterobacter cobi, Enterobacter absuriae. You also have, you have heard of the Burkholderia cepacia group. You also have, and this one I have talked about and made some episodes in this podcast, the Staph aureus complex, where you have, Staph aureus, Staphylococcus argenteus, Staphylococcus singaporensis. When you go to anaerobes, you have the Bacteroides fragilis group. So definitely this is something very common. Several organisms, and they are put together under one group or a complex. So this happens for Bacillus. So you have several groups, and they are Bacillus cereus group, B. circulans group, and B. subtilis groups. And the other genera that I mentioned, Bacillus, Brevibacillus, Lysine they are closely related. So Bacillus, they are aerobic, facultative anaerobe, spore-forming rods. And an interesting fact about spores is that Bacillus is the only clinically relevant species that can produce spores in the presence of oxygen. And these spores, they may appear intra or extracellularly. And those of you that have seen gram stains of Bacillus, you know this. You see the spores as a clear area in the cell. And there's also a procedure where you use malachite green to visualize the spores. And in this procedure, the spores look green and the cell looks pink. And did you know that in the lab, the spores can actually be induced in the organism? Well, this is something very interesting. So they can be induced by growing the organism in triple sugar iron agar or urea. And they can also be enhanced by performing heat treatment on the organisms. And this is done by incubating the organism at 70 degrees Celsius for 30 minutes or 80 degrees Celsius for 10 minutes. You definitely, if you remember triple sugar iron agar, I did an episode about it. So if you want a refresher, go ahead and check it out. And while we are talking about triple sugar iron, this is something that I had some feedback recently as I was promoting episodes in the podcast about, that they don't see the usefulness basically of talking about triple sugar iron agar. Because, the chemistry is interesting, but in the lab, we really don't use it. And that is true, I haven't used triple sugar iron agar in any of the labs that I've been on. But it definitely provides a nice visual for the students to see, fermentation, gas production. And at the same time, students have to learn about it because they are still tested in their boards, such as like the ASCP, American Society for Clinical Pathology. And I am not too familiar with other parts of the world. I see people using them, so I am sure they use them. So we still have to talk about them because students, they learn about it in school. So while, definitely we don't use them in the lab as often, we still need to learn about them. Okay, so having said that, let's go ahead and talk about the Bacillus cereus group. So just like other groups or complexes, this group is made of several species of Bacillus. They are found in the soil and they are widely distributed in nature. As a group, they are associated with infections in immunocompromised patients with diseases such as cancer or diabetes. And healthcare workers are also implicated in transmitting it. So we definitely, as healthcare workers, we have to be careful, right? We have to make sure that we wash our hands, we change gloves. In the lab, sometimes, I see technologists and just, I'm not trying to point fingers but I have seen techs, that they do work without gloves. And so we have to be careful, right? So even if you see patients, or if you don't, like we do in the lab, that we just work with the samples, we have to make sure, right, that we wash our hands properly, we use our PPE, we disinfect areas. And this is very important because, healthcare workers, unknowingly, a lot of times, we can transmit organisms to the patients. And that is not good. And nowadays, especially in an era where we have our phones on all the time, that we're using it. I mean, I have seen people using their phones while transporting patients. We're doing all sorts of tasks. So we have to make sure also that that device is properly disinfected. Other infections of the Bacillus cereus group, they include the urinary and respiratory tract. And then, Bacillus cereus and anthracis are two members of the Bacillus cereus group. And like I said, I will talk about anthracis by itself. So let's go ahead and talk about Bacillus cereus. So what's associated with it? Well, those of you that are medical laboratory scientists, either students or have graduated already, might be saying the answer out loud right now, fried rice poisoning. And you will be correct. This type of poisoning, like food illness, is associated with different foods such as meats, vegetables, and milk, among others. It is referred to as fried rice poisoning because a high number of cases are seen following rice ingestion. As far as symptoms, diarrhea and abdominal pain are experienced within 8 to 16 hours. Other symptoms are nausea and vomiting within 1 to 5 hours. And Bacillus cereus produces certain toxins that are implicated in the diarrheal infection. And these are hemolysin Bl, non-hemolytic enterotoxin, and cytotoxin K. And there is a toxin that is associated with the nausea and vomiting. It is heat stable and acid resistant, and it is called cerulide. Another disease associated with Bacillus cereus is endophthalmitis, and this is an infection of the tissues or fluids inside the eyeball, and this can cause permanent damage. Another member of the Bacillus cereus group is Bacillus thuringiensis, and this one can also produce the cerulide enterotoxin. An interesting fact is that toxins of Bacillus thuringiensis have been commercialized for insect control, and this is for insects that cause damage in agriculture. Other instances where Bacillus thuringiensis has been recovered are wounds, burns, and pulmonary infections. However, these are rare. Most species outside of the three I mentioned are generally considered to be opportunistic pathogens with low virulence. They tend to be associated with immunocompromised patients. However, I am going to go ahead and talk a little bit about them. So I'm going to start with the Bacillus subtilis group. So Bacillus subtilis, that has been implicated in cases of food-related illness. With B. subtilis, some isolates that were previously identified as Bacillus subtilis, they have been renamed. And you know how this is, right? As more molecular advances are made, or as different properties and reactions of the organisms are discovered, the names of the organisms change. Right? Can you think about some name changes? Well, definitely in this field recently, and fairly recently, Klebsiella aerogenes used to be Enterobacter aerogenes. Remember Propionibacterium acnes? It is now Cutibacterium acnes. So definitely you see a lot of name changes. And the old school texts, the ones that have been working for 30 years, they say, sometimes, they joke saying, in my day, everything used to be called Pseudomonas. And you know what? It might not be that far, right? You remember like Burkholderia cepacia used to be called Pseudomonas cepacia. So definitely the name changes in microbiology, they are very common. So there are reports of B. subtilis, being implicated in pneumonia, bacteremia, and septicemia. However, it is difficult to prove it that some of those cases are actually from B. subtilis because of this, it been renamed. And then two other members of the Bacillus subtilis group, there are Bacillus licheniformis and B. pumilus. Bacillus licheniformis has been associated with complications of surgery and medical devices. Bacillus subtilis and Bacillus licheniformis are also associated with endophthalmitis. Diseases associated with B. pumilus are septicemia, anthrax-like infections, and septic arthritis in immunocompetent children. As far as members of the Bacillus circulans group, some have been implicated in cases such as bacteremia, endocarditis, and wound infections, among others. So before we talk about morphology and biochemicals, let's go ahead and talk about spores. So these spores, or endospores, are spores that are produced within the mother cell. And the purpose of this, the spores, is survival. The organism produces them in conditions conditions that are less than ideal, such as extreme temperatures, lack of nutrients, or drying. And they can survive in extreme conditions and can resist disinfectants. And I mentioned earlier that healthcare workers have been implicated in the transmission of bacillus. So, the spores of Bacillus cereus are resistant to disinfectants and have been traced to contaminated gloves, gowns, dressings, and even hospital equipment. So like I continue to keep saying, definitely very important, right? Changing gloves, making sure that, if your lab coat, you change it regularly, especially if you see that it's visibly soiled, change it. Gloves, always disinfecting your areas, make sure that, keep your phone away. So definitely, we have to be careful, right? Because we can definitely, especially if you work with patients, you have to be careful because, you can transmit something to them. So you don't want to be that person. It's just, we're here to help the patients. And inadvertently, sometimes, we can cause some damage. So just definitely be careful. So going back to the spores, as I said, they are made for survival. So you have harsh conditions, high temperatures. So everything that the cell needs to replicate, it's in the spore. And then they survive for a long time. Then you have ideal conditions. And then once again, they continue to replicate and resume their normal shape. So this is always very interesting. And it's always very cool when you see them in the microscope, when you see that clearing in the gram stain. So let's go ahead and talk about morphology, media, and biochemicals. Bacillus species, they are gram-positive rods, like I mentioned. And you hear terms such as boxy, that's associated with them. And as you know, you have all these terms that you associate with gram stains. I mean, you definitely have some cellular arrangements, right? Like, you have your clusters, you have your tetras, you have your chains. And then when it comes to gram-positive rods, you start using all these descriptions, right? Like lactobacillus, long thin rods, listeria, short rods, bacillus, boxy, Corynebacterium, Chinese letters. So definitely all these terms, and as you're a student, definitely remember these terms because it will help you when you get case studies for your exams or for your ASCP or any other board that you have to get certified for. So they are called boxy, bacillus, and this is due to their square-ended shape. They are large gram-positive rods, and as far as arrangement, you can see them in chains, singly, or in pairs. And you can get variability with the staining. And for you students out there, what is variability in a gram stain? What do you mean when your organism stains variable? Well, definitely when you stain, when you perform a gram stain, right? Gram positive, so your end product is purple. Gram negative, your end product is pink. So when you have variability, you have a combination of both. You either see some cells that are purple, some cells that are pink, or sometimes, even the one cell that it just has kind of like both colors. So variability is very common with bacillus. So it makes you think, especially when you're a student and you're working on your gram stain technique, And those of you that work in micro, you know that this is a process that it takes a while. And I definitely exhort students, and young techs, and by young I mean like just out of school, that don't have as much experience, get comfortable with your gram staining technique. You use the manual one. I know nowadays, especially if you're in a large hospital, that you have an automated instrument, which is very helpful. When you have a large volume, you can stain several smears at once. But definitely get comfortable with your staining, because as everything in microbiology, there's a lot of repetition. And I know that sometimes brand new techs, they jump to the instrument because it will do the job for them. But sometimes, reagents run out, the instrument malfunctions, and then you end up with an unusual stain, and you might make a mistake. And the same thing with your manual one. You get comfortable by doing it over and over again, but sometimes you do mess up. Sometimes smears come under decolorized, sometimes they come over decolorized. So when you are looking at Bacillus, you kind of makes you think that you might have messed it up. And it could be sometimes, maybe if you didn't properly decolorize, or you added too much, left it on for too long, or maybe too little. It could happen, so you end up with a variable smear. But however, with Bacillus, this is very normal. And this is because, it can be because the culture is old, or because spores are produced. And like I mentioned, the spores appear as an area of clearing, so this means that they don't stain. So a typical classic gram stain of Bacillus is large rods, which are actually larger than other organisms that are gram-positive rods. So if you are, playing with gram stains and practicing, and if you're taking some sort of lab, some sort of course, and when you're doing gram-positive rods, I invite you to go ahead and do combinations, of course. If your instructor doesn't offer that option, definitely ask. I encourage students to try combinations, seeing all those rods side by side. So Bacillus is definitely larger than, let's say, your Listeria, than your Corynebacterium. And I will say probably, Lactobacillus might be longer. But Bacillus, they're definitely, the size is larger than Lactobacillus. You get those long, thin rods with Lactobacillus. But definitely, as far as how big they are, Bacillus is definitely larger than Corynebacterium, Lactobacillus, and Listeria. So definitely, like I mentioned, just keep that in mind. Larger, bigger rods, and then maybe, sometimes, Lactobacillus, they can be longer, but they are definitely thinner. And this is something to keep in mind. Associate those morphologies, because like I said, sometimes especially it helps you think in cases of about normal flora versus pathogenic, and you are taking an exam. It definitely helps you, when you get a case study and you hear boxy, long thin rods, and terms like that. So now that you're familiar with the gram stain, now we have to talk about biochemicals and media, and that's gonna be in the next episode. And that, my dear audience, it's the end of this episode. I hope you enjoy learning about Bacillus and all the different groups, morphology, gram stain. As always, I enjoy sharing this information with you. Continue bringing that passion to what you do. It's always definitely very important. It will make you better at what you do. Of course, always, educate yourselves, continue learning, studying. But definitely that passion. It makes you better at your job, and the patients will benefit. So continue bringing that. As always, thank you for the support. Thank you for listening. Good things are going to keep coming your way. I will continue working and bringing more information to you. So as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.